You are listening to The Scope, a podcast dedicated to having open conversations about healthcare topics relevant to our patients and community. Today we're talking about cardiac health. Let's get started. Today our guest is Dr. Dmitry Familtsev, a Phelps Health cardiologist. Welcome to our show today.
Hi, thank you. How are you?
Good, how are you? We're
Good.
really excited to have you here.
Thank you.
I feel like I just saw you.
Yes, you did.
Yes. So before we get started, we really love to start off our show with our providers telling us a little bit about themselves and their practice.
My name is Dr. Familtsev, Dr. Dmitry. A lot of people know me here by one of the general cardiologists at Phelps Health, seeing patients as an outpatient in clinic and inpatient. And I've been here for over it's getting close to 2 years. Enjoying it so far. Job is great, and we're taking care of every type of heart condition here at Phelps Health. You name it: heart attacks, post-heart attack care, arrhythmias, vascular type of diseases, primary prevention of coronary disease and strokes and all that is all part of our daily operations kind of thing.
So one thing that you mentioned is that you take care of all types of cardiac events. Is that pretty unique because we live in a rural area?
I think it's the heart disease, especially coronary artery disease, is common everywhere. It's number one leader in mortality and morbidity of the population in this country and the world. So it's common everywhere you go. And I think it's wonderful that we have a lot of specialists here to take care of those type of issues if a patient encounters them.
So today, one of the things that we're going to focus specifically on is coronary artery disease. So what is coronary artery disease? Let's explain that.
The coronary artery disease, there's several types of coronary artery disease, but coronary artery disease, the most commonly is due to lipid-rich plaque or atherosclerotic plaque. Those are basically deposits of the fat or bad cholesterol, what we call it, because there's bad and good cholesterol. And those deposition form plaque inside the vessel of the heart, the vessels that supply the heart with blood. And over time, that can build up to the point where the blood is not sufficiently going to the parts of the heart and cause symptoms. There could be a chronic disease, which is slow buildup of that plaque, or it could be an acute coronary syndrome when the plaque becomes unstable, opens up, thrombus or clot forms, and that's the one, the heart attack that everybody thinks about, that they show on TV, that can actually cause sudden cardiac death or really, really big damage to the heart function if not taken care of immediately.
Now, you also mentioned symptoms. What are some of those symptoms if somebody is experiencing coronary artery disease that they're going to feel?
The symptoms of coronary artery disease are most likely going to be chest pains, so precordial or retrosternal chest pain. It's in the middle of your chest, on the left side of your chest. Many times it radiates down your left arm, neck, or jaw. But this is not the only presenting symptoms in people with coronary artery disease. A lot of people, older people, women, and very commonly diabetics, especially uncontrolled diabetics or who had diabetes for a long time, may not have the typical symptoms of chest pains during the heart attack. Even the big one, sometimes there's no symptoms at all, and then only the aftermath of the heart attack, kind of like a heart failure and swelling and shortness of breath, may give us some clues that patient experienced an event. Or symptoms like shortness of breath, dyspnea on exertion. You're really trying to do what you used to do 2 months ago and you can't because you're short of breath, or you're tired because of those. Those are the biggest symptoms of coronary artery disease.
So at what point is somebody concerned enough to seek medical care or medical treatment whenever they're experiencing the symptoms?
I think every time you have a retrosternal chest pain, kind of may raise a worry. You can explain sometimes to yourself why you have it, but sometimes things can be deceiving, right? Lots of times I see patients who are kind of in the intermediate or category for the risks for coronary artery disease. They're either younger population or never had any event before. And they tell me, you know what, I was doing something physical, shoveling snow. That's appropriate for today's. And I started having chest pains. Well, sometimes it's difficult to say whether they pulled something because they were physically exerting themselves doing an exercise they never do otherwise, or they really uncovered some issue there with blood flow and all that. So it is important, if it's concerning enough, to ask your doctor and see if there is, by symptoms themselves or with additional tests, this can be investigated any further.
So there are also some types of tests that people can take to kind of determine if they're having some type of cardiac event, right? What are those tests?
Yeah. So the most important thing is of course the history, the presentation of the chest pains. Many times you can talk to a patient and they say there's no way it's a cardiac pain. Has all characteristics of non-cardiac pain, and people don't need anything in that case. But if you have a suspicion if the chest pain is typical or atypical and patient has significant risk factors, diabetic, obese, cholesterol's high, had prior heart attacks, have significant family history, then you can, depending on the symptoms and your level of suspicion and the risks, you can justify either doing, for example, a stress test, which is a fantastic test because many times we can make a patient to reproduce an amount of exertion that's causing chest pain and see, or go straight to looking into the vessels. It's called coronary angiogram, taking a look at the blockages inside the heart, if there's any, and at the same settings, many times you can fix them. There is other modality that is widely used nowadays, especially in the younger population. It is called coronary CT or computer tomography. That is a quick CT scan that is directed at your heart vessel, can detect plaques and blockages pretty well as well.
So let's say somebody has already had like a heart event in their life, right? And they're on medications. Are there any types of medications that they shouldn't be taking, or should they look at the medications that they're taking together? What's the process look like for them?
Yeah. So what you're really talking about is the secondary prevention of coronary artery disease. There is a primary prevention when a patient did not have any event yet, but has risk factors, and we need to control those so that patient hopefully never have an event. Or the secondary prevention, which is, as you asked, that happened, patient had heart attack or stroke or has significant blockages in the arteries of the lower extremities, for example. And we already now know they had a disease. We want to prevent the second event. That is very important because people who had heart attack or stroke, that's their biggest risk factor for the second one. They are much more likely to have the second one if they had one before. So medications is definitely an adjunctive to lifestyle modifications. We talked about this during the radio show. There are a lot of those primary preventive measurements go into the secondary prevention too, and the most important things are diet, exercise, losing weight, all that is very important. Sometimes difficult to introduce and difficult to implement right away in the same setting, but has to be done. But us as a doctors, as cardiologists, and very often as a good primary care doctors as well, we should help people to achieve the risk reduction with the medications. And those are always include a statin medicine, atorvastatin or rosuvastatin, Crestor, Lipitor. Those are the highest intensity statins. This is to reduce cholesterol, because over and over we show, especially with the latest studies, that the lower your bad cholesterol levels, the lower your chance to either have a first or second, third, a heart attack or stroke. It prevents it pretty well. The other medicines that are necessary for the patient to be taken is aspirin. Baby dose or 81 milligram aspirin is very important in prevention of secondary prevention of coronary artery disease. The latest study on primary prevention showed that we used to think that baby aspirin is good for everybody. That's doesn't hold true anymore. We actually rarely prescribes aspirin in somebody who had no heart attack, stroke, or peripheral vascular disease, unless they're diabetic, and even then studies are kind of equivocal. But for the secondary prevention, absolutely, especially if the patient had stent, they take antiplatelet therapy, which aspirin is antiplatelet. What it does, it thins your blood, it doesn't let thrombus to stick together and build in a setting of new heart attack, and prevents it that way. If the patient received stent or bypass surgery for their blockages, they should take another antiplatelet agent, which sometimes for the simplicity we call a super aspirin medication. Those are Plavix or Brilinta. Prasugrel is another one. They are actually necessary to keep the stent open and not to let stent to clot within the first year after the stent. Now that's gonna get shortened based on requirements and bleeding risks and all that stuff, but usually 1 year is how we keep the patients on the medications. So those are very important medicines. Now, a lot of times patients come to me with the older patients many times, and they take a bunch of medications. I mean, that list, it's just, I have...
It's probably longer than my page.
Correct, yes, sometimes you have, if you think something is flickering in your eyes there, when you look through those medications. Patients really shouldn't be, unless they really have a lot of comorbidities on a lot of medicines. It's called polypharmacy. It's a problem in itself. It's easy to mix up the medications, forget to take forget to take the most important ones, or simply have no money for all of those medicines. So that's always needs to be looked into. And patients frequently take things like vitamin C, vitamin E, coenzyme Q. A lot of those medications have been proven not to be helpful. And I try in my clinic to stop those medicines. I always joke with my patients. I say, unless you're a pirate and you're on a ship without the fruits and vegetables, you don't really need a vitamin C in this country. Vitamin C is everywhere, right? Just eat your fruits and you'll be, especially with vitamin C being a water-soluble vitamin, you just basically pee the extra out. You don't get to hold to it. So vitamins, different over-the-counter medications that I wouldn't advise to take them. They cost a lot of money and they've never been proven to do anything for you. And then chelation therapy, there's certain medications that are chelators. They're not, there's really equivocal studies, not useful at this particular point in time. And we talked about this the other day. The hormonal therapy for women. A lot of women come to me after menopause and they say, hey, I know that I had my menopause, I lost my estrogen protective quantities of the for the heart, for the
what can I do to
disease.
supplement?
Do you think starting myself on the hormone replacement therapy is useful? Unfortunately, it's not recommended currently, just for prevention of coronary artery disease. It hasn't been shown to be useful. And it has its risks. Those risks should be determined by your primary care or your gynecologist, whoever you talk about that. Clot formation, risk of cancers are all elevated with the replacement therapy on estrogen, especially if it's unopposed. And then the other things like yoga, acupuncture, there's really not enough evidence that this is helpful. It may be, we just don't have enough evidence on that. So the big thing that we control is blood pressure control and cholesterol control. Those are medications that are kind of pillars of preventing the second stroke or second heart attack and all that. Fish oils is a very important topic too. Studies are equivocal. Okay, so there's no great study that says that supplemental fish oils are really, really good for you, except for one medication that is very expensive. It affects your triglycerides. That's it. We're talking about fish oils affect triglyceride level mostly. LDL cholesterol is taken care of by statin if patient can tolerate that. And triglyceride levels are also affected by statin, but to a less degree. The fish oils are what affects the triglycerides. That's why fish in your diet is really, really good supplement. But when you take an over-the-counter fish oil that's not FDA regulated, you don't know what dose you take, and the dose of fish oil may be different from pill to pill. You don't know who produces that. When you get it from pharmacy, really. There's some studies that have some positive effect of the very high dose of fish oil, which is 4 grams a day. But the expensive medicine that is advertised to control triglycerides, they just had a few years ago a fantastic study. Everyone was amazed by the fact that relative reduction is 25% in the mortality and morbidity and the repetitive heart attacks in somebody who already had them. But just recent conference in cardiology actually kind of presented the study that kind of not repeated, could not replicate those findings, and it's still kind of up there for debate, especially for the price that we have to pay for that medication. It's not that if patient can tolerate already or the insurance is great and they paid and the triglycerides are really controlled, you should stop it. But you have a really high threshold to start that medicine, fish oil, to protect a patient.
So that brings up another question for me is, what is your opinion on taking vitamins in pill form versus vitamins in tincture form?
So I don't think, if it's approved by the pharmacy, I think they're pretty equivalent. Sometimes the tinctures are just nasty at tasting. It's just easier to take, just easier to swallow a pill and not drink the fish. Again, for the fish oil, there is no approved form other than the pills. And the fish oil, you actually have a pretty bad fish breath kind of thing when you take it, except for that other medication that is really expensive. They change the molecule there, and that molecule change, that's what the thing is actually more effective than the other ones. It doesn't make you have a fishy breath. But currently it's pills mostly.
So something else that whenever you were talking about this, it made me want to talk about diet, because you kind of mentioned that you can take all the vitamins in the world, but what really is going to be most important is that diet and that lifestyle modification. So let's talk about that for a second. What's your recommendation on diet and lifestyle?
Yeah, there's a lot of diets going around, and diet is not necessarily starving to death or eating plant-based meals only. The diet can be high-calorie diet, high-fat diet, you name it. I always like to say that a lot of my patients have a high meat, high fat diet. So it's the only diet that is proven to be really helpful for prevention, either primary or secondary prevention of coronary artery disease and stroke, is a Mediterranean, what it's called Mediterranean diet. Mediterranean diet is the diet that includes a really majority of this comes from vegetables, fruits, nuts that are not too salty because of their blood pressure issues in many of those patients. It includes lean meats, really little amount of red meat, but mostly white meats, and fish, the most important fish. At least twice a week you're supposed to eat fish, one of which at least should be an oily type of fish. And no fried food, no food that is full of trans fats, bacon.
Most American food.
Correct, especially at breakfast. Yes, a lot of processed food not only have a lot of salt in it, but it has a lot of saturated fats because the way they cooked. And the saturated fats is actually what increases your bad cholesterol and is bad for you.
So something you had mentioned before on our radio show that I thought was incredibly interesting is whenever we buy meat from the store, our meat has salt in it, correct?
Yes, so if you go in and you pay attention, if you start paying attention to your salt content, a lot of my patients tell me, I don't add salt to anything I eat. And I always uniformly say, you don't have to, not in this country. You don't have to add salt to anything. It's already added there for you. Your really recommended amount of salt is 5 grams of salt or 2 grams of sodium per day. And it's it's very difficult to maintain because everything we eat has salt. When you go to Kroger or whatever grocery store and you buy your meat there, even the raw meat that needs to be cooked already has salt in it for preservation purposes. So very, very important to follow those kind of, some people are really, really particular about their salt content. Some people don't want to do it, but definitely not salting your food on top of what's already done is the first step to improve that.
So something else that you had mentioned before that I think is worth noting on this podcast, since we're talking about heart health, is this thing called metabolic syndrome. Can you explain that for us?
Metabolic syndrome is a very big problem in the United States. About 40% of people will go under that category, which is a very large number. Metabolic syndrome includes a combination of obesity, especially abdominal obesity, the high blood pressure, and diabetes. It also comes with high cholesterol usually. So combination of those 3-4 things are kind of an umbrella of metabolic syndrome. And people with metabolic syndrome are very, very commonly have much higher risk of coronary artery disease and stroke down the line, especially if they're young. They have to watch that. They have to control it as much as it's possible with the help of primary care and sometimes preventive cardiologist to avoid the issue.
Now, what about things like tobacco, smoking, drinking? How do those affect our heart health?
It's number one preventable cause of coronary artery disease and stroke. What does it mean is that it's very easily modifiable. The probably highest risk for the patient is their family history. You can't modify that yet. You got your dad and you got your mom, and if you got bad genetics from them, you got to be vigilant about this and seeing doctor and preventing the disease. But smoking is very preventable, and it's number one cause and preventable causes for those issues. Smoking is really, really bad. I mean, I can't stress this enough to patients. A lot of patients quit smoking after they have their first heart attack. It's kind of sometimes too late, but it's better than not quitting smoking because after a few months, well, actually after a few months, you start getting the benefit of non-smoking, reducing your risks. And they showed in the study that about 3 to 5 years after you quit smoking, your risks from smoking in terms of coronary artery disease and stroke are now equivalent to somebody who never smoked. So you need 3 to 5 years away from the cigarettes, any types, even one cigarette is bad, to reduce your risks really to that point of non-smoker. So do not smoke, do not vape, that is also bad. Do not chew, do not do anything that relates to tobacco. Tobacco industry is very happy about you paying them taxes, and it's I don't think it's a good idea for your health. It's very preventable, and it's not a fashion.
Yeah, save your money and go buy some like expensive fish or something.
Correct. Or a bag of nuts with no salt in it.
Yes, exactly.
Yes, correct.
But those, for a lot of people, those don't taste as good because we've almost in American culture trained our taste buds to want the sweet and salty stuff, right? So how do you retrain your taste buds to want those good, healthy fruits, nuts, and vegetables?
That's a very good question, Patricia. So yes, definitely salt and sweet taste is an ever-changing thing. But the good thing about this is that you can train yourself both ways, as long as it's conscious attempt to do that. People in my clinic who I advised to reduce their salt and they were successful, I see them a year after, and they say they cannot eat foods they used to eat just because how salty it tastes to them. So the more salt you eat, the more salt you want to have and crave, and it's kind of a vicious circle. So retrain yourself to a lower salt, suffer for a little bit, and then you get in this, the food will be tasting normal to you again after some time.
Mm-hmm. Yeah, it's almost like habits become part of your lifestyle, right? You just have to make small steps to make them habits.
It is, and the same thing goes for sugars. Especially for diabetics, so important. Preventing diabetes, controlling diabetes is one of the most important things we should do as cardiologists to prevent coronary artery disease and strokes and peripheral vascular disease as well. When you eat something that is very sugary and full of sugar, you release a lot of insulin. That's a person without diabetes or even type 2 diabetes too. And the insulin makes you even hungrier. So the more sugar you eat, the more you crave the sugar, the more you eat, the more you eat in general. So another experiment that I like my patients to do is to cut amount of sugars they eat. And I'll tell them, just wait 2 weeks. Just give yourself 2 weeks of this experiment and you'll see your appetite will be reduced, you eat less, you won't crave that sugar. Sugar things are going to be too sweet for you. Our tastes can be changed back.
So that leads me to another question. What's the difference between like sugar and somebody who's trying to get off sugar? Maybe they switch to like erythritol or like stevia. Does that have the same effect on our brain?
So, and probably there's the people who are better equipped in this to answer this question. For diabetics, there's no doubt going into this sugar replacement products such as stevia or any types of artificial sweeteners is a great idea because it reduces their sugar intake by a lot. However, there's some studies that tell you, oh yeah, drinking sodas that are diet sodas is a great idea because you reduce it's a 200 calorie can, 150 calorie can of if you drink Pepsi or Coke. But unfortunately, when you drink a lot of diet sodas, it shown to lead to actually weight gain, but through another mechanism. When you drink something sweet, and those artificial sweeteners are much sweeter than actual refined sugar, you trick your body into drinking or eating something really sweet, but no calories come with it. The body thinks, that is wrong. So it bumps up all those appetite hormones and other hormones to get that, to extract that amount of energy that comes with, the actual sugar, and you eat more. You're found to be eating more because your appetite is more, and some studies show you actually gain weight with drinking those.
Yeah, I would not be surprised to find that. So we have a couple of minutes left, and I know that it's Heart Health Month, and I want to give you a couple of minutes to just speak to our listeners and share any piece of advice that you might give to them.
Yeah, so the biggest thing is that heart health is very important. It's been important for many years, and we're getting much better in treating heart disease. We're getting all the tools to treat advanced heart disease, whether it's advanced heart attacks or heart failures. We're getting much better in prevention. Statins is a fantastic medication if you can tolerate them, and the statins reduced the acute heart attacks over the course of past 10-20 years significantly. But you should always know your risk factors. You should always know your genetics. This is very important if you can, and pay attention to things that may improve your overall health. We all know what it means to be healthy, right? But it's difficult to achieve. Every day you should kind of nibble at a little bit of yourself to make yourself a little better, whether it's exercise, whether it's reducing your sugars, especially if you're diabetic, whether it's a better diet, and better sleep, less stress. Stress control is important too. Those things are difficult to introduce, but they must be done because they're the most important thing in prevention of those very common and very often debilitating diseases.
Fantastic. Thank you so much for being on our show today.
Thank you.
Thanks so much for tuning into The Scope. If you liked our show and would like to know more, check out phelpshealth.org.